Good morning. This is Jody Friedland. I want to thank you for taking time out of your busy schedule to come listen to my interview presentation. Many of you already know me as I have been at Marian since 1999. Before that, I taught at St. Elizabeth's School of Nursing in Lafayette for 14 years. I received my diploma in nursing from Wishart Memorial Hospital School of Nursing, my BSN from Marian, my MS from Ball State University, and my doctorate from Clayton College of Natural Health. My clinical areas included ICU, CCU, ER, oncology, hospice, and geriatric nursing. I have taught in med-surg, all levels, OB/GYN, mental health, fundamentals of nursing, physical assessment, professional role courses, nutrition, leadership, and other courses outside of nursing. This presentation focuses on active listening responses that are used in therapeutic communication. The students have already read the information in their textbook, have their handouts, and have listened to the previous lecture. I will be focusing on seeking elaboration, paraphrasing, restatement, sharing observation, seeking clarification, reflection, silence, minimal clues and leads, and summarizing. The following patient-nurse interaction includes examples of these techniques. The nurse in the interactions is a student nurse. CH is a male 76-year-old who was transferred from another hospital in eastern Indiana. The diagnosis was new onset seizure and aspiration pneumonia. He is to be transferred to a local extended care facility later this month. He is able to communicate verbally and has no hearing impairment. He has left hemiparesis. His wife is expected soon before noon, and he is in a room by himself. The radio and the TV are off, and he is in a wheelchair waiting for breakfast, which isn't due for about 45 minutes. The room is a bit cool and dark. He wears a left leg brace and is sitting in his room. His staff nurse was in the room when I arrived and was talking about his foot. He was visibly agitated with the nurse, but not towards the student nurse. The conversation starts after the nurse leaves the room. The goals in this interaction for the student includes the use of therapeutic communication and active listening responses, to encourage the client to express the feelings, to maintain a mild level of anxiety, and maintain an open posture. The client-centered goals include sharing feelings regarding his limitation and maintain a healthy level of anxiety. Good morning, Mr. H. My name is Norma, and I'm going to be your student nurse today. Based on the conversation you're having with the nurse, it sounds like you're having a difficult time.
Yes, last night I yelled for 2 hours for someone to come help me with my leg. It was caught underneath the bed frame. I didn't get hardly any sleep last night, and I'm still waiting on my breakfast this morning.
I can see why you had difficulty sleeping. You said your leg was caught underneath the frame. Tell me how your leg's feeling now.
It's doing better now, but I'm getting tired of all of this. I know that I'm the crankiest patient on the floor.
Sounds like you're saying you've had enough.
Yes, I've had enough, and I did yell a lot last night. My foot was stuck and it hurt, but it is doing better now.
Okay, so I heard you say that your foot was stuck and you're feeling better now?
Yes, but please stay and talk with me. Do you square dance?
I used to a long time ago, but I did notice your eyes lit up when you talked about square dancing.
My wife and I used to square dance, but that was before my first episode.
What do you mean by episode?
A stroke, they called it. Now I can't do any of my old hobbies. I used to play guitar, sing, go swimming. I used to be out and about all the time. Now I'm just cooped up in the house all the time.
You sound frustrated that you're not able to do your old hobbies.
If anyone had bad luck, it would be me. I can't do the things I enjoy anymore, so I guess there's no use talking about it.
Go on.
I just want to get my breakfast. I've been awake since 3 o'clock.
I heard you talk about having concerns about the care you received last night, but also about sadness about the activities you've lost since your stroke. We can talk more about that later, but I'll go get your breakfast for you now.
Well, thank you, Norma.
You're welcome.
The next few slides will take each interaction and look at how active listening responses were used in each response. The first one you see was the starting of the conversation. And basically, she started by sharing observation. Is that what you thought when you heard the interaction? And really waiting for that eye contact made the student nurse realize, I think they're ready to talk. In the next exchange, the nurse decided to use elaboration. Elaboration is kind of like what this cook is doing. You keep adding things to it to get more and more information. And that's what this was the intent of this active listening response, was to elaborate. She wanted the patient to know more. I want to know more what the patient said, is her idea. In the third interaction, the nurse used paraphrasing. Paraphrasing is used when we want to make sure we check that we understand what the patient had said. That information you got from your handout. I just wanted to go a little bit further with it. It's not summarizing, it's not a reflection, but it is paraphrasing what my interpretation as the nurse of what they said. And then the patient can either say they agree or disagree. It's paraphrasing. The fourth interaction, the response there was the use of restatement. And looking back on your handouts, you were informed that restatement is an active listening strategy used to broaden a patient's perspective, or when the nurse needs to provide a sharper focus on a specific part of the message. So that's what was used here. And restatement's been used in lots of ways, and that's where I got the Edward Snowden statement to put on this slide that you see. But you know what? I believe George Orwell may have been the first person to have said that sometimes we really need to restate the obvious to make sure everybody's on the same page. Sharing observation. It's what you see when you're talking with the patient, and you tell them, you share that information with them in the hopes that it will get them back to what the subject is that you want to talk about. And in this case, this patient's eyes just lit up when he started talking about square dancing. Plus, he asked a question and the conversation got turned back around to the nurse, and the nurse had to get it turned back around to the patient. The patient was trying to avoid the subject, I believe, and so the use of sharing observation worked very well with this interaction. The use of seeking clarification, especially in this interaction, the word episode could have meant lots of different things. So the nurse in the interaction had to find out, what did the patient mean by episode? And so that was why a clarification question was asked. It's when, again, we want the facts. So clarification is used to verify these facts. The seventh interaction in this conversation was the use of reflection. I'll tell you, the patient was beginning to get a little emotional, and reflection is a great listening response to use to focus in on the emotional part of the message. Along with this, the use of touch was used as well, and really 55% of the communication is through body language. So the hope that the nurse thought maybe touching him would convey empathy and encourage them to continue on this conversation that was beginning to be a little uncomfortable for the patient. In interaction 8, you saw a therapeutic use of silence. Remember, silence is used to just give people a chance to collect their thoughts. It's usually just a brief disconnection of time, and it conveys that this is important to me. I know this is important to you. Let's think about this and before we go on. So that's the use of silence here in this example. The nurse then uses a minimal clue or a lead, such as go on, to break the silence and have the patient and give the patient permission to please continue. So that's what that is. Other examples that you'll see on your handout on the minimal clues and leads are oh really, that kind of thing. So they include go on for this one for the patient to continue in his thoughts. From the interaction from 8 to 9, the patient decided to change the subject. It was getting too much for them. The best thing that he could say to change the subject as far as he was concerned was, I'm ready for my breakfast. It was hard for him to think about all the activities that he's lost. So the nurse decides to do a little summary, and the idea of summary is, here's what we have covered so far. And in this summary, she also included, you know what, I'll be back later to talk about this. She's trying to tie it all up before she goes to get his breakfast. But she is aware that he wants his breakfast. And as you know, we need to focus on what the patient needs right then and there before that they'll focus on what we think needs to be continued. So that's what the nurse did in this situation. Then the patient says, thank you. So now here is your part in this assignment. You will see in Canvas there's a worksheet that you'll need to fill out based on this conversation. What I want you to do is for each nurse response, I want you to make an alternative statement or a response that you believe would have been better for the nurse to have made, and include your rationale for why the alternative response or statement, or state why you would not change it if you thought it was the appropriate response. Identify the type of response you used. And again, you can find those listed in Arnold and Boggs on page 79. And you can also use your handout as a reference. If you have any questions, please let me know. And you could drop it in the Canvas assignment box. This slide shows the references that I used to discuss the active listening responses. And also, I wanted to thank my husband for volunteering to play the part of the patient. Wasn't he a good sport? And I also wanted to thank my son Andrew for being the cameraman. Thank you for listening to my presentation.